Have you ever considered how vaginal size compares to penile size, or how the vagina adapts during arousal to ensure comfort, pleasure, and compatibility in intimate moments? Let's face it, when it comes to conversations about sexual wellness, there's one question that always dominates the room: penile size. But what if I told you that focusing only on one side of the story is limiting your understanding of intimacy, and potentially your satisfaction? Here's the truth. The vagina is one of the most remarkable and adaptive organs in the human body, yet most people know shockingly little about it, especially when it comes to its size, its structure, and how it all works during intimacy. Today, we're diving into what science actually says about vaginal dimensions and why understanding this, regardless of gender, can completely transform how we approach sexual health, confidence, and connection. In this video, we're going to separate fact from fiction. I'll take you through evidence-based insights, debunk age-old myths, and show you how vaginal health can be strengthened naturally, leading not only to more satisfying intimacy, but better long-term physical well-being. So if you're ready to stop guessing, start understanding, and truly take ownership of your sexual health, stay with me until the end. Trust me. This is the information everyone should have been taught, but no one talks about. Let's begin by exploring what science tells us about vaginal dimensions. Recent research published in the International Urogynecology Journal employed high-resolution MRI scans to assess the anatomy of healthy adult women. Findings revealed that the average vaginal length at rest ranges from approximately 3.5 to 4 inches, about 9 to 10 centimeters, with the wider population range falling between 2.5 to 5 inches. These findings are corroborated by a large-scale study involving over 3,200 participants, published in the American Journal of Obstetrics and Gynecology, which identified a mean vaginal length of 3.7 inches. Further clinical assessments at Elizabeth Garrett Anderson Hospital in the UK echoed similar findings, noting that vaginal length is not only variable, but also dependent on factors like age, hormonal status, and levels of arousal. Interestingly, vaginal width also fluctuates depending on measurement point, ranging from around 0.6 inches near the opening to 1.8 inches toward the cervix. Now, what's truly remarkable is the adaptive capacity of the vagina during sexual arousal, a natural physiological process known as vaginal tenting. During this response, the uterus and cervix retract upwards, elongating the vaginal canal and increasing both its depth and width. This expansion can add anywhere from 1 to 2 additional inches in length, enhancing both comfort and compatibility during intercourse. Let's talk about compatibility. According to a comprehensive meta-analysis published in BJU International, the average erect penile length globally is approximately 5.4 inches, 13.7 centimeters, with 95% of men falling between 4.2 and 6.7 inches. What this tells us is that there is significant anatomical alignment between the average penile and vaginal lengths, which naturally supports pleasurable and pain-free intimacy for most couples. Yet, despite biology being on our side, myths about vaginal size and elasticity persist. It's time we address them, not with opinion, but with scientific fact. Myth number 1. More sexual activity leads to a loose vagina. Fact: this is simply not true. The vaginal walls are made of highly elastic muscular tissue, capable of stretching and returning to their normal resting state. Much like the bladder or the stomach, the vagina expands as needed, and then contracts. Regular sexual activity does not loosen the vagina. In reality, elasticity is far more influenced by genetics, hormonal fluctuations, particularly estrogen levels, and the health of the pelvic floor muscles. Myth number 2. Vaginal size drastically shrinks with age. Fact: while it's true that with age, especially post-menopause, estrogen levels drop, leading to changes in tissue tone, vaginal length only decreases by a marginal amount, approximately 0.08 centimeters per decade. Such changes are subtle and rarely impact function. Myth number 3. Vaginal laxity cannot be improved. Fact. On the contrary, strengthening the pelvic floor through targeted exercises such as Kegels and integrative pelvic floor physical therapy can significantly enhance tone and control. This not only improves sexual satisfaction, but also supports urinary and core health. Understanding the dynamics of vaginal length is not just an academic exercise. It plays a critical role in real-life intimacy. During intercourse, the vagina's ability to stretch, lengthen, and adapt ensures that differences in anatomical size between partners do not impede comfort or pleasure. However, this adaptability operates best under the right conditions, namely adequate foreplay, sufficient lubrication, emotional connection, and physical relaxation. So, how can one care for and strengthen their vaginal health? As a physician, I often recommend a comprehensive but simple plan grounded in scientific evidence. First, prioritize pelvic floor health. Regular Kegel exercises, when performed correctly and consistently, help support the uterus, bladder, and bowel, while enhancing vaginal elasticity. Recent studies have shown that up to 70% of women who engage in pelvic floor training report improved sexual satisfaction and reduced pelvic discomfort. Second, maintain optimal hydration and healthy estrogen levels. Moisture, both systemic and local, is essential for the integrity of vaginal tissues. Women going through menopause or experiencing dryness may benefit from estrogen therapy or clinically approved vaginal moisturizers under guidance from a healthcare provider. Third, don't hesitate to explore pelvic floor therapy. For women recovering from childbirth, abdominal surgeries, or hormonal shifts, licensed pelvic floor specialists offer targeted rehabilitation that can restore strength and confidence in daily and intimate life. Fourth, protect your microbiome. Avoid harsh soaps, scented douches, or overuse of disinfectants, which strip away the vagina's natural protective flora. A balanced vaginal microbiome is your first line of defense against irritation, infection, and discomfort. Finally, schedule regular gynecologic exams. Preventive care is cornerstone medicine, and that includes vaginal health. A qualified obstetrician-gynecologist can assess tissue tone, hormonal status, and screen for concerns long before they become disruptive. In closing, the female anatomy is exquisitely designed, adaptive, resilient, and capable of supporting a lifetime of healthy sexual and reproductive experiences. The average vaginal length, in both resting and aroused states, aligns remarkably well with the corresponding range of penile lengths, ensuring physical compatibility is rarely an obstacle to shared pleasure. By staying informed, debunking myths, and investing in pelvic health, women can take control of their intimate well-being, not just for today, but for every stage of life. As always, individual variations are normal. However, with the right knowledge and care, vaginal health can be preserved, enhanced, and celebrated. Because sexual health is not a luxury. It's a vital part of your overall wellness.